I'm Erica Smith with Henry Schein. We are shining light on the 5 areas that might be falling short in your exam room, jeopardizing the safety of your team and patients. The CDC states that hand hygiene is the #1 best practice for preventing the spread of infection. But studies show that there is less than a 50% compliance rate with U.S. healthcare workers. Remember to wash your hands for at least 20 seconds, ensuring proper techniques to ensure the surfaces of your hands and fingers are thoroughly cleaned. Be sure to know when it is appropriate to use alcohol-based hand rub versus soap and water. When using hand sanitizer, confirm that the alcohol content is at least 60% to effectively kill any pathogens on the skin. Remember to avoid touching the face and contaminated surfaces and perform hand hygiene before and after patient contact. Finally, promote strong compliance by leading by example and holding your team accountable. Lack of environmental cleaning can happen easily in any healthcare office. However, there are ways to prevent that from happening. Provide education training. Ensure that all team members, including healthcare providers and support staff, receive comprehensive and consistent training on proper cleaning techniques, infection prevention protocols, importance of environmental cleaning, and preventing healthcare-associated infections, or HAIs. Establish clear protocols and standards. Develop clear and concise protocols and standards for environmental cleaning, including cleaning frequencies, cleaning products to be used, and procedures for high-touch surfaces and patient care areas. Implement monitoring and auditing systems. Establish systems for monitoring and auditing environmental cleaning practices to ensure compliance with established protocols. Regular audits can help identify areas for improvement and reinforce accountability among team members. Improper handling of sharps in healthcare setting poses significant risk, including needle stick injuries and exposure to bloodborne pathogens. Those risks can increase with factors such as overfilling sharps containers and disposal of sharps, and using improper containers. To help prevent these risks, make sure you and your team follow the fill level on sharps containers to prevent overfilling. Conduct risk assessments to determine the appropriate disposal frequency, likelihood of contamination, and potential risk to your team and patients. Also, be sure to follow all local, state, and federal regulations for sharps containers and disposal to help maintain safety throughout your office. Adherence to instructions for use is the cornerstone of safe and effective practice. These guidelines provide essential insights and protocols to ensure optimal patient care. Following IFUs can help enhance different aspects throughout your practice. Proper cleaning and disinfection protocols. IFUs provide detailed instructions on the proper cleaning, disinfection, and sterilization of medical devices and equipment, reducing the presence of infectious agents. Prevention of cross-contamination. By following IFUs, your team can minimize the risk of cross-contamination. Proper disinfection and sterilization procedures outlined in IFUs help prevent the spread of infectious agents from contaminated surfaces or equipment. Proper training in infection prevention and control is essential for reducing HAIs and protecting your team and patients. When you ensure proper IPC training in your office, you help different areas in your practice, such as reducing HAIs. Effective training equips your team with the knowledge and skills to implement best practices for preventing the transmission of infections, ultimately reducing the incidence of HAIs among patients. Protect your team. Training ensures that your team members understand infection prevention and control protocols, including proper use of PPE and adherence to standard precautions. Enhance patient safety. By implementing proper IPC measures, you and your team can create safer environments for your patients, minimizing the risk of acquiring infections during their visit. By following these tips and equipping your team with the necessary knowledge and skills, you lay a strong foundation for preventing cross-contamination, ensuring compliance with regulations, and fostering the culture of safety. Be sure to click the link below to learn more of what you can do to help enhance safety in your practice.